Hello, this is Tom. Today I'm gonna give you a presentation for Group 12. Our presentation is about hospital healthcare robot. Background and objectives. When the whole world is hit by coronavirus, could anybody imagine that such a tiny virus could give the world such a hard punch before? When so many schools and businesses have to shut their doors, how should IT professionals and roboticists think about it? Is there a reason for them not to be so pessimistic? Yes, it is. Sometimes chances hide behind crisis. Nobody could predict that masks could be so well selling, just as no one could anticipate that robotics could be driven by the pandemic better than anything else. We are not exceptions. Nobody in my group could think of that a small virus could inspire us so much. Nobody realized that robots could overcome some challenges so easily due to their natural features or advantages. When it is impossible to put social distancing into practice, robots stand out. When some countries have headache because of shortage of personal protective equipment, have they thought about that they should have paid more attention to robotics? Robots should play a critical role in the pandemic. They do not need PPE because coronavirus is nothing to them. Our project is a use case of robotics in this pandemic. Doctors and nurses often have to come close to patients because of their job. Even if they wear PPE, we still cannot 100% make sure that coronavirus will not penetrate into their PPE. At this point, robot can help. Our project is to enable medical robots to do some routine tasks so as to lower the chances that healthcare workers get themselves exposed to coronavirus. For example, a medical robot can replace a doctor or nurse to go to a hospital room for daily diagnosis and deliver some critical materials such as medication. Our project is based on our in-class exercise 1, 2, and 3. Moreover, we combine and extend them a bit. Introduction. COVID-19 patients need medical care frequently, especially for those who have severe symptoms. Regular check is more necessary. It was not supposed to be a challenge before this pandemic time. However, because of COVID-19, this simple and easy task is not as simple as it used to be. According to recent research, COVID-19 is 10 times as contagious as flu. It raises a new concern about healthcare workers. How to keep our heroes safe. Personal protective equipment does help, such as medical masks, gowns, and gloves. But how to meet such a huge demand in such a pandemic time? Millions of people got infected. Tens of thousands need hospitalization. It needs tens of thousands health care workers as well. Can you imagine how much PPE we need? Tremendous. So, can we find an alternative way to do the task? That is right what our group wants to figure out. We totally understand that it is very difficult to enable a robot to undertake some advanced duties of healthcare, such as comprehensive diagnosis and surgery. But can we look into those duties and classify them so that we can spot some simple tasks that robots can undertake? With the question, we did research for medical tasks. One of our findings is that in most cases, or most of the time, a healthcare worker just needs to do some simple tasks, such as asking a patient if he needs help or delivering some medications. Very simple, but it still puts our healthcare workers at the same risk. So, is it feasible that we use a robot to do the task? The answer is yes, because we just need to send a remotely controlled robot to a hospital room and interact with the patients through a simple human-robot interaction method, such as dialog box. Another task that we believe a robot can undertake is to do UV light sanitizing for the hospital room. In this case, even we do not need to interact with any patient. We just need to send a remotely controlled robot to the hospital room. Then let robot do sanitizing according to remote instructions, or run the program previously injected in the computer system of the robot. Methodology: human-centered design. Our team keeps considering our end users from the very beginning of our project. We prioritize the needs of our end users over anything else. Our project is driven by our overriding concern about the safety of healthcare workers in the pandemic. Sense of imperative speeds up our developing. Everybody in our team wants to contribute more and develops faster. Sometimes collaboration is better inspiration and corrector. Cooperation with discussion avoids mistake and detouring wrong way. Fewer mistakes brings about higher efficiency. That is the power of human-centered design. Human-robot interaction. In my in-class exercises, I used nonverbal communication as the method of human-robot interaction, such as dialog box. I feel verbal communication is better as it takes less time and the patient does not need to touch the touch screen. In the pandemic time, it is very meaningful because it reduces the chance that robot carries coronavirus. So in our project, we choose verbal communication. Robot understands human through voice, but understanding failures should be taken into considerations, which nonverbal interaction seldom runs into. Prototype design. Scenario 1. A doctor or nurse sends a robot to a hospital room and check if a patient needs help. The robot initiates a robot human interaction by saying, "How are you feeling today?" and smiling. If the patient says, "Good," the robot will say, "Okay, please let me know when you need help," and go back. If the patient says, "Not so good," the robot will say, "Okay, I will let doctor know," with worried expression, and go back. Scenario 2. A doctor or nurse sends a robot to a hospital room to do UV light sanitizing. The robot initiates a human-robot interaction by saying, "I was sent to do UV light sanitizing. Do you feel comfortable with that?" If the patient says yes, the robot will do UV light sanitizing, smiling. It will walk through the whole hospital room and lift its head up to positive 20 degrees, then lower its head to minus 20 degrees, then turn left for 90 degrees, walk forward for 30 centimeters, and repeat the same procedure until it finished the whole room. If the patient says no, the robot will say, "Okay, please let me know when you want me to do UV light sanitizing," then leave. Conclusion. We basically achieved our goal, that is to enable robots to undertake some simple duties of healthcare worker, such as regular check and UV light sanitizing, so as to lower their risk of getting infected. One of the reasons why we can achieve it is that it does not need artificial intelligence. For currently existing robots, they are not so much real robots as controlled machines, no matter if we control them through remotely controllers or programs in the computer systems of the robots. We also wanted our robot to take some relatively advanced duties, such as diagnosis. However, it goes beyond the scope of this paper, as it needs artificial intelligence. According to our knowledge, there is no such an algorithm or a set of algorithms which can model the whole process of a doctor's diagnosing a patient. For future discovery, we need to figure out if there are such algorithms first. Even if there are, we still need to consider if we can describe them well through mathematical model. By the way, is it true that for everything in the world we can find an algorithm corresponding to it? Maybe, maybe not. We do not know. It needs to be proved. Next, we need to think about if it is feasible to make a program according to such algorithms so that it runs well in currently existing computers. Otherwise, it is meaningless to make such a program. In short, finally, robotics is a matter of artificial intelligence. That is the bottleneck of robotics. There will not be a big breakthrough in robotics unless there is a big breakthrough in artificial intelligence. Finally, we put some references at the end of the slides. That's all for today. Thank you. Bye.